Hi, I'm Dr. Jeffrey Hall at Hall Plastic Surgery and Rejuvenation Center. Let's talk about breast reconstruction. When do we talk about breast reconstruction? Well, it's usually a situation where a patient's been diagnosed with breast cancer and is going to need a mastectomy. So you'll come to the office after seeing your surgeon and we'll talk about what the options are. Definitely there's not a perfect reconstructive procedure for every patient. So we'll talk about what your circumstances are, consider your age, your health, other risk factors, and come up with a plan that's individualized to you. Reconstruction is going to be a way to achieve a, let's say, wholeness, in that we're going to be replacing that volume of your breast with a reconstructive procedure that's going to allow you to wear your clothes like you want to and feel like a whole person. Well, definitely today our standard is to do breast reconstruction at the time of the mastectomy. In the early days of reconstruction, there definitely were some concerns about whether it would be safe, but we have done this for many years and I think our patients get better results and are able to get further down the road in the recovery process if we do the reconstruction immediately. Now, definitely reconstructions are different than our other procedures for breast surgery, and that our goals are to create a piece of your anatomy or part of your anatomy that is going to be as close as we could ever get it to be what it was before your mastectomy. Part of the process will be visiting with me in the office. Definitely it's important to recognize that the primary objective is going to be to treat your breast cancer. So your surgeon is going to talk to you about that. You'll probably visit at some point with an oncologist, but I'm going to be here to help figure out what would be your best reconstructive surgical procedure. After our consultation and visiting with you, I'll be able to make an assessment on your circumstance on what would be the safest procedure for you to get you through the process and to have a reconstruction that's going to meet our goals. Our approach will be different for the person that's younger versus the person that's older. Definitely the older person is going to be the one that's more likely to choose the simpler procedure with the quickest recovery, whereas the younger person may be somebody that wants the complex procedure and is not as focused on the recovery. So being treated for breast cancer can be a long process. So I think the reconstruction gives a person a light at the end of the tunnel. So that gives them some optimism, let's say, that they're back to normal and they can get on with their life. The breast cancer patient has been a patient that you get a relationship with that's almost like family. So it's very rewarding to me as a person, as a surgeon, to be able to be there to help get them back to their life as best as possible. There's nothing like seeing the smile on the patient's face when you get to that last point where you're saying, okay, we've completed everything, and because it's such a contrast when we see them and they're in the process of chemotherapy. It's just something that warms your heart when you see them smile. Again, I'm Dr. Hall at Hall Plastic Surgery and Rejuvenation Center. Hopefully this information has been some help, especially in the person that's thinking about breast reconstruction after being diagnosed with breast cancer. And I would look forward to meeting you in the office and getting to know you and helping you as best as possible.